All right, we're off. Thank you so much for being here. My name is Liz Morris, and I'm an Outreach and Access Coordinator with the network of the National Library of Medicine. And I'm really pleased to welcome you all to the first webinar in our series called Bridging the Digital Divide, Telehealth and Libraries. Today's webinar is titled Get to Know the National Consortium of Telehealth Resource Centers. I'll be reviewing our goals and introducing our excellent panel of speakers shortly. For those of you who may be new to our work, the network of the National Library of Medicine, or NNLM, is the outreach branch of the National Library of Medicine, which is part of the National Institutes of Health. NNLM promotes equal access to evidence-based health information for biomedical professionals and the public at large. We are divided into 7 regions across the United States, territories, and freely associated states. Our regional medical libraries provide funding, conduct outreach, and develop and deliver free training to advance the NNLM mission. As a national network, we collaborate across regions on several national initiatives, which currently include confronting health misinformation, bridging the digital divide, and addressing environmental determinants of health. Today's webinar is supported by our National Telehealth Interest Group, whose work aligns with NNLM's initiative to bridge the digital divide. So we have a really excellent panel of speakers today. Our hope is that as a result of attending this session and learning from our experts, you'll be able to identify the Telehealth Resource Center serving your community, that you'll understand relevant resources that are available to you from the National Consortium of Telehealth Resource Centers to support your work, and that you'll learn about some effective collaborations between libraries and telehealth resource centers. We have compiled all of the resources that our speakers will be covering today into a single handout for your ongoing reference. You can download that handout as a Word document via the link that my colleague George has posted in chat, and he will post it a few more times throughout this session so you can access those resources. We've also allotted about 10 minutes of Q&A at the end of the session. So if you post a question in chat, know that I'm tracking it. I'm tracking all of them, and we'll work to address as many as you can after we hear from all of our speakers. So today we're going to be hearing from Arya Javedan, who is a project manager with the National Consortium of Telehealth Resource Centers, Reed Plimpton, a program manager with the Northeast Telehealth Resource Center and Digital Health Initiatives with MCD Global Health, Christina Higa, who's the co-director of the Pacific Basin Telehealth Resource Center, and Jolene Johnson, who's a program manager with the Northwest Telehealth Resource Center. I will invite them all to share a little bit more about their backgrounds and their roles when they dive into their portion of the presentation. So with that, Arya, I'm going to turn it over to you and appreciate you all being here. Thanks so much.
Thank you, Liz. I'm going to share our slides. There we go. Thank you again for the introduction, and thank you to the Network of the National Library of Medicine for the opportunity for us to present today as part of this webinar series. Hello, everyone. My name is Arya Javedan, and I'm the project manager for the National Consortium of Telehealth Resource Centers. Just to provide a little bit of background on the National Consortium of Telehealth Resource Centers, or NCTRC, it is a collaborative of the 12 regional and 2 national telehealth resource centers committed to implementing telehealth programs for rural and underserved communities. We are funded by the U.S. Department of Health and Human Services, Health Resources and Services Administration through a cooperative agreement from the Office for the Advancement of Telehealth. The first group of TRCs were funded in 2006, and for the last 17 years now, the program has grown and expanded across the nation. In 2017, the 14 TRCs began working collaboratively under the consortium, and today the 12 regional centers combine to cover all 50 states, the District of Columbia, the affiliated Pacific Islands, Puerto Rico, and the U.S. Virgin Islands. The remaining 2 centers have a national focus, with the Center for Connected Health Policy focusing on telehealth policy, and the Telehealth Technology Assessment Center focusing on telehealth technology. The NCTRC provides unbiased, nonpartisan, and expert telehealth technical assistance to various healthcare organizations, networks, physicians, and others throughout the country with a particular emphasis on rural and medically underserved areas. The regional TRCs are experts in telehealth implementation and are equipped to provide technical assistance, education, and resources on various topics. Each TRC has a regional uniqueness, allowing them to provide a wide range of assistance targeting local community needs. The NCTRC website, telehealthresourcecenter.org, acts as a clearinghouse for TRC curated resources, including fact sheets, toolkits, reports, news stories, and translated resources. There's also a central Contact Us page where you can submit your request for technical assistance. There is an interactive map where users can easily locate and contact their regional TRC depending on their location. We have an experts page which features TRC staff with different areas of expertise depending on your need, including fields such as operations, clinical services, education, research, and remote patient monitoring. The website features 4 collections of resources, which I'm going to go into a little bit deeper in the following slides, but they are telehealth basics, technology and broadband, FQHC telehealth resources, and unwinding of the public health emergency collection. So first, the telehealth basics collection features resources on really how to get started with telehealth, what best practices you should follow, what's required from a technology standpoint, as well as operating procedures and financial planning. Just a few informational fact sheets we have here are how patients can engage telehealth and what is telehealth, which provide just basic information on telemedicine and common definitions of the different modalities. The Northeast Telehealth Resource Center has also created a downloadable toolkit for 8 tips on how to host a successful telehealth video session. The consortium has created a fact sheet which provides recommendations for providers when treating patients with disabilities via telehealth. It includes both general recommendations for providers as well as specific tips when treating patients who are deaf or have hearing loss, patients who are blind or have vision loss, and patients with physical or developmental disabilities. Additionally, the Heartland Telehealth Resource Center has a patient-facing video that takes you through the steps on how to prep for your telehealth appointment. A few resources to highlight in the technology and broadband collection are virtual care security tips for patients, which is developed by the California Telehealth Resource Center. That fact sheet provides cybersecurity tips for patients to ensure their protected health information is secure. TTAC also conducted a video platform assessment where they did a networking stress of several common video platforms at a variety of bandwidth speeds and conditions. The video on the website is a sample of some of the test footage captured in that assessment. And then TTAC also has a number of technology toolkits, clinician's guide to video platforms, direct-to-consumer, home health. And they've also collaborated with the California Telehealth Resource Center and developed a telehealth technology needs and readiness assessment, as well as additional toolkits such as common mistakes to avoid when choosing and implementing telehealth technology. The FQHC Telehealth Resources Collection are resources specifically relating to federally qualified health centers. Some example resources are a Critical Access Hospital Guide, which provides practical guidance on implementing and sustaining telehealth to optimize healthcare delivery, expand access, and enhance care coordination. The NCTRC also conducted a 3-part FQHC webinar series with topics on chronic care management, substance use disorder, and mental and behavioral health. And then finally, multiple TRCs recently collaborated to develop a telehealth for FQHCs / RHCs video series. And that video series is designed to provide educational content for FQHCs as well as rural health clinics to assist with their telehealth implementation on a variety of topics, including school-based telehealth, marketing, and process improvement. And then our final collection, Unwinding of the Public Health Emergency, or PHE for short, provides a central site for end-of-PHE telehealth flexibility planning and includes several blog posts on Medicare reimbursement, anti-kickback, and Stark laws, and a fact sheet that provides telehealth key dates surrounding federal telehealth flexibilities. The NRTRC also created an end-of-the-PHE telehealth compliance checklist that includes important info relating to reimbursement for telehealth services and use of telehealth to perform required face-to-face visits. And then lastly, the Center for Connected Health Policy created a post-PHE billing policy document that looks at various policies impacting different provider types, including practitioners, clinics, and hospitals. I just want to take a few minutes to point out some of the resources by the 2 national TRCs. So TTAC houses several technology toolkits on their website. Clinician's Guide to Video Platform, Direct to Consumer, mHealth, and a Technology Assessment 101. These toolkits allow users to learn the fundamentals of how various technologies work, as well as how to assess them for use in telehealth programs. For Innovation Watch, TTAC has also compiled several resources revolving around innovation in technology and broadband in the field of telehealth. These include new product development that can help expand the realm of telemedicine, as well as other innovative products and items that impact healthcare. And then finally, TTAC has developed a short video series, Tech Talks with the TRCs. The series features short videos on telehealth topics presented by TRC staff, and topics in the series include technology assessment, Project Echo, behavioral health, and remote patient monitoring. CCHP, the National Telehealth Policy Resource Center, has several policy resources available. They have a new policy finder tool on their website which tracks and compiles telehealth-related laws and regulations across all 50 states, the District of Columbia, as well as at the federal level. A few special features of the policy finder are the ability to compare the policy of any of the selected topic areas such as Medicare and Medicaid, private payer, or professional requirements for any 2 states. The policy finder database is updated consistently throughout the year now, but CCHP still publishes their state telehealth laws and reimbursement policies, with the most recent update published in spring 2023. They also produced a fact sheet that reviews the telehealth-related items that CMS has decided to finalize for calendar year 2024 in their physician fee schedule. And they recently released a new updated telehealth billing guide to clarify telehealth billing and reimbursement, current legislation dictating billing requirements during calendar year 2023. And they also have a video series that provides sort of telehealth policy basic explainer videos that provide a deeper understanding on telehealth policy in fields such as licensure, prescribing, and HIPAA and privacy. We also host an educational webinar on the third Thursday of every month from 11 a.m. to 12 p.m. Pacific time. The webinar series delivers virtual peer-to-peer webinar learning sessions to support the adoption of telehealth across the nation. All of our past webinars and PowerPoint presentations are also available on our YouTube channel. I, of course, just provided really a sampling of the TRC resources available. There are plenty more telehealth resources on our website, telehealthresourcecenter.org, as well as individual TRC websites. We also have a skills matrix available on our website, which lists skill areas and clinical telehealth specialties each TRC has if you're looking for a specific area of expertise. We also send out a newsletter featuring upcoming TRC events and conferences and new telehealth resources created by the TRCs. Here I've just included contact information and direct website links for all 12 regional TRCs as well as the 2 national ones for reference. Again, there is an interactive map and centers page on our website that lists all this information as well. And with that, I will pass it over to our next speaker, Reed Plimpton, Program Manager for the Northeast Telehealth Resource Center.
Thanks, Aria. Thanks, everybody, for having us and for joining us today. When Liz first reached out to us, we were obviously very excited to get to know you all, but I think we also couldn't resist the chance to share some information and hopefully make your guys' life a little bit more easier and exciting as we head to this next phase. So I have a few slides and then I'm going to turn it over to some of my other colleagues. To elaborate on just a little bit about the Northeast Telehealth Resource Center. If I was smart, I would have put our region of the map on here again. We cover all of New England and New York. And I often joke that NCTRC has 2 parent organizations. Myself and the majority of our staff is housed at MCD Global Health, which is obviously a global company, a global nonprofit with U.S. bases in Maryland and Maine. And then we have some clinical and telehealth operations staff at UVM. With that, the only other thing I'll call out is, I want to make sure we share some of the resources that we do. Telehealthclassroom.org is one of our new exciting things that we've started doing since COVID started. It's a free training resource, I think, right now. That list is actually incomplete. I think there's 2 other trainings that we just recently released, and we're kind of constantly updating those. So those are available for you to view. And then my last thing I'd say on this slide is I have no disclosures or conflicts of interest that I have to share. On the next slide, a little bit more about us and what we do, some of the exciting things that we've done recently. This first bullet is also the images you see. It's we recently redesigned our website, and with it we launched the beta of this tool that I'm really excited about. We're calling it the T3, the Telehealth Technology Test. And as you can see in that second image, with that one link, an individual is able to check their broadband speed, ensure their video is working, and ensure their microphone is working, which, whether that's a health system sending to their patients, a library making available for their patients to take home and use, or individuals using just on their own accord at their house, should improve the efficacy of the starts of video visits is our goal. That second link, I thought is a recent news publication on some work we're doing at MCD that Netric has sort of just supported regarding the role of e-consults in telehealth and in the healthcare marketplace, and looking at how, if you have specialists available for photo or other documentation consults, how that can add to a visit or an encounter. And that's something I grabbed because I thought is, in an ideal world, as policy catches up to technology, something that could work in a library setting. And then that last one, I didn't just put in there because it says library. I hope that's useful for you all. Our telehealth resource library is something that we've been curating for a number of years now. Last time I looked, I think it had over 6,600 different publicly accessible journal articles, presentations, webinars, so on and so forth regarding anything on telehealth. On the next slide, I think, is actually really just a filler. Like I said, we couldn't resist a chance to share some information with you guys. And so I just have a couple examples of how telehealth access points, or a community location or a library specifically, is tackling some of the considerations that play into being a conduit for a telehealth visit. And so all of these bullets are hopefully things that you've either already accomplished because you're currently already being a conduit, or you have time to figure out before you start offering the ability to host video visits for individuals with their providers. Because in part it'll make your life easier, and then also there's some legality and things like that tied in here. So on the left, we're actually talking about just the physical location and the realities of that, right? So more than likely, you're going to have a predetermined room or rooms in your facility that you're doing these video visits in. Make sure that everybody that works there knows where that room is and how to get there, right? And you can see why in that next underlined section. But then take some time, once you've decided that's the room and you've set up your computer and your devices, actually fire up a video visit and see what the lighting looks like in there. Make sure that the audio is coming through clear, and that you can hear somebody else's audio clearly in the room. All of those things can, differ by the design of a room, whether it's, a glass door, so on and so forth. And then the safety issues that need to be considered, I kind of just started teasing them out a little bit, but more than likely you won't have a medical professional in your library during this health interaction. So if there is an adverse situation that happens, what's the plan, right? Who is contacting emergency medical services? Is it already known to the provider and the health organization that they will be the one contacting, and that they tell the ambulance the patient is at X library, and walk into the front desk and they will tell you where the room is? Or is it that there's some sort of button that can be pressed, or whatever that is? Just developing a safety plan in case anything happens. I guess a good example would be one of our colleagues who's a telepsychiatry provider was recently talking about one of his patients at a skilled nursing facility who fell out of their chair in the middle of his visit, and he was not sure what that meant, like if they were going to get back up, if they had potentially broken something, so on and so forth, until they called up to him and let him know that they had really just slipped, and they would be with him in a second. On the right side, shifting to some lighter notes, scheduling considerations. Some of the projects I'm working on right now have really helped me think through this, and hopefully it makes it easier for you. How are you receiving these video visit links? Is it the second white bullet on the right side is probably the easiest route for you, right? Which is that individuals in your community are informed that you have this space and they are able to reserve time or show up and ask for that space, but you are not involved in housing the video link that they'll need to access their visit. Or is it that you have created connections to health systems to the point that once the patient has consented, the health system could send a video visit invite to a predetermined email address, right? Like room1@statelibrary.org or whatever that is. And then that email address is always there. The patient can come in or they can use the calendar. Again, I think the second one's a little bit more feasible considering how broad your community is. It's not a closed cohort, but either way is something you could do. And then with the accessibility considerations, I actually think given time and knowing that I'm touching on other stuff or touching on these in other slides, I'm going to skip that section of this slide. So Aria, if you don't mind, please advancing us to the next one. This is more concrete examples of what I was just thinking, what I was just talking you through, right? This is more on the technology side of things, but they're all measurable and achievable things. I often joke, if you want a good example of how not to have great teletech etiquette, you can watch me. I'm moving around, I'm looking at multiple screens, I'm talking too fast, I'm usually wearing some sort of pattern that might contrast with the pattern that's behind me. So all of those things are stuff that you can take into account, and you can even, make a handout for your community members to take home and think about before they show up and use your space. But the thing on the right side is the stuff that you have a little bit more control over, right? The lighting, I mentioned that already. Background considerations, as a rule of thumb, you want the light to be behind the camera so that you don't end up with like a halo or, some glare or anything like that. And then whether or not you have a wired internet connection because you need it, I will say that that's probably not necessary for libraries given your ability to have 100 up, 100 down. And EHR integration, again, that would be kind of up to the health systems as to whether or not you would need to have that level of integration with them. On the next slide, this is what I was just alluding to a moment ago. If you are in the business of exploring accessible considerations for a video visit, the field is vast, and it's really important to know what accessibility aspects you're trying to improve, right? Are we talking about vision considerations? Are we talking about hearing considerations? Are we talking about both? Are we talking about physical ailments, intellectual, so on and so forth? And so this table is regrettably not ready to be shared to you as a PDF just yet, but will be soon. It's something that Netric's been working on. And it really just tries to look at different disabilities and the potential way to improve the digital interactions that those individuals may have, right? So you have the solutions, you have the planning considerations, and the alternatives. On the next slide, I think we have four more disability to consider. So like I mentioned, mobility, speech, mental health and psychosocial. There are AT considerations for that in particular, and then the cognitive, the learning, and the neurological. I will also call out that last one. There's usually some additional tests involved too, right? And tech is what I meant to say. Some additional devices involved and or apps that the individuals may use on their phones. On the next one, trying to, again, share the wealth of resources. Everybody that's joined me for this presentation had the pleasure of getting to work with the North Carolina DHHS a few months back to develop, I think it was over 25 different fact sheets diving into some of what I just referenced, accessibility considerations for individuals that have a myriad of disabilities and how to ensure that telehealth is just as available for them as it is for the rest of us, and that it works as well for them as it does for the rest of us. We have, in turn, as TRCs, developed some other resources, which is that second link. And then throughout this process, we actually did kind of uncover that the World Health Organization has a fact sheet and a report on considerations for the accessibility of telehealth services. So that's linked there as well. On the next one, this is something that I'm actually also going to give everybody on the TRCs a chance to chime in on. It's digital navigators is a new-ish term that I think is really exciting to me. And it's, I think the easiest way to wrap your head around it quickly would be to say that it's the helpers. It's you, it's community health workers, it's visiting nurses, it's family members, it's individuals that have the ability to help an individual achieve having a successful telehealth visit. And so the digital navigator term is one that I think has sort of stuck the best as an accepted wide applicability term. And so there's various different trainings that are coming out and about. And actually, Jaylene, if you want to drop your link in there, notice it didn't carry through in this version. There should be a fourth link that's referenced here. The Northwest TRC developed a free course called Navigating the Telehealth Neighborhood that, again, dives into the specific strategies, considerations, and tips and tricks that you would need to be a digital health navigator. Yeah. Now, on the next slide, expanding upon this, again, everybody on this call was involved in it. All the TRCs that are on this call were involved in it. Through our Health Disparities Committee, we kind of piggybacked off of Northwest Awesome's training resource and developed this digital navigator toolkit, which is really a repository of all of the different trainings, resources, and agencies that are referencing this term and how everyone is seeing it play out. If you haven't picked up on it yet, I think I already said it, but I personally consider librarians as a great digital health navigator, which is why I've teased that in here. On the next slide, next two slides to round me out here, I just wanted to show another strategy of a non-health site functioning as a technology access point, a telehealth access point rather. This is a community health worker model from Massachusetts, and community health workers it's a whole policy conversation as to why they're not fully leveraged to the best of their abilities all the way across the nation. Each state's handling their interaction with telehealth as medical professionals differently, but I think because of that, it's something that easily, it's like a plug and play type deal, right? Like if you imagine this woman in the middle as actually a librarian, you will lose some medical availability of some of this, but you can do so many of these things. You can be a healthcare facility could refer a patient to you so that they can have their follow-up via video. You could, if you have, interactions with the health systems, coordinate services, so on and so forth. But you can do things you're already doing as well, right? Be a health education access point, help people access anything they need, so care navigation, informal counseling. I know there are libraries in the nation that, have spaces for things like that to happen. Yeah, so hopefully this is just an idea for folks to work with. And then on the next slide, I actually have some photos and a kind of breakdown of how this group in Massachusetts is using that community health worker model that I just showed you. And so you can see that they're actually all stationary setups in all three of the schools in that district that they're doing this with. Some sites that we work with do use carts, right? So you don't have to permanently dedicate one room. But in this one is sort of a lower tech threshold, right? You already have monitors, you already have PCs. Likely already have cameras, so it's really just dedicating that one space and developing the processes as such. I lied, I think I have one more, and it's just telehealth access points. Yes, yeah, and so this is again some great work that Northwest has done to tie together some threads that all of us as CRCs have been pulling, and all the work that you all are doing and why you're here. I don't think I can implore you enough to go to wimtracking.com/taps and enter your address as soon as you feel ready to be a telehealth access point. We are actively working this into some of the other maps that Northwest has and that some of the other TRCs have in a different mapping project, and exploring other NCTRC resources is a way to get this information out there. But in the meantime, I would definitely encourage you guys to get on it. And with that, I hope I didn't take too long. That's my director, Danielle Louder. That's me moons ago. And yeah, thank you guys so much.
Thank you so much, Reed. I'll take it from here. Aloha, everyone. My name is Christina Higa, and I'm the co-director of the Pacific Basin Telehealth Resource Center. So we serve the state of Hawaii and the U.S. affiliated Pacific Islands. And my part of this presentation is tell you the story about how this TRC, PBTRC, is working with our state libraries. This is a photo of our team. And also, I just wanted to point out the woman in the middle screen, Stacey Aldrich. Maybe some of you know her. She is our state librarian, giving you the shaka there. She has just signed up our FQHC doc and my co-director in updating their library cards in that photo. Next slide. So today, I'm going to talk about our collaboration with the state libraries, our Department of Health, and PBTRC in establishing our telehealth project in our libraries. It's primarily funded through the Center for Disease Control through the Department of Health in a health equity grant, but it also has many other sources of funding, including FCC and, of course, HRSA as our contribution. We also have many anchor community partners, including nonprofits, academics. I felt to mention that I'm part of the University of Hawaii, and also community health centers. Next slide. So the project will establish library telehealth access points throughout Hawaii state libraries. I know there are many library telehealth projects, and you'll be focusing on that. So I'm happy to share where we are on this initiative. We're at the start of this project and will go on through 2026. As many of you have, we have designated rooms, and if not, if there are not private spaces, we have been installing pods. All of our libraries have very good broadband connectivity with a minimum of 1 gigabits. Our library will also be loaning out Chromebooks and MiFi hotspots for people who would like to do their consults from home. Our project will have navigators housed in the libraries, and as Reed mentioned, these navigators would help to provide the education, training, and support. A third component of our project is really focusing on workforce development in our communities, our rural communities, and community engagement. Next slide. So to just share some of our lessons learned, and as I mentioned, we're still in the very initial stages, so I want to say, and still learning. We're really trying to figure out how to get this right. You know, I mean, the utilization in the libraries for telehealth is based on a lot of different components. And one of the things that I really want to stress here is the partnership with the local community. And I just crossed out key as a key role to saying that it's really critical to be successful. As you all know, you work in your communities and libraries, but when we're trying to do something that's so dynamic and crossing over many sectors, having the local community-based organization has been very critical for us. They've taken the role in facilitating with our healthcare providers and FQHCs, and not only clinical service providers, but also the social service providers, people who are providing transportation, food support, and housing, etc. They also helped us to really identify what is needed for staffing. Is it a navigator? Is it a community health worker? And further, as we started to just generally recruit, we really needed the community support to help us identify people who are available for the jobs, the right person, someone looking for it, you know, making that connection. And also just so key in having the outreach and support and communication and marketing to the communities. And that's the next point. It's really important to let people know that these resources are available. So including the providers, right? The providers need to know that they do not need to pay IT support for their patients, that they can refer that person to the library, and our navigators can take the time and walk their patients through how to use telehealth and all the various platforms. Of course, we want our patients to know that the resources are available in the libraries, and we want all the various community programs that have intersecting mission and needs to also realize that this is a resource. I'm not going to talk a lot about it, but a parallel project is this project will have mobile clinics also in the communities. And so as they go to people who maybe don't find their way to the library, we're hoping that that will be in transition for introducing them, getting familiar with the telehealth and services available. And then, you know, maybe on their third or fourth telehealth visit, they'll know that they can walk to the libraries. For whatever reasons, you guys probably know better than me. Many of our homeless shelters, for example, or areas where people congregate are near to libraries. And so if we can get our mobile clinic out there, get them familiar with the schedules and all of that, they can walk over into the libraries. But we also heard from our IHS groups, for example, saying my patients and patrons would never walk into a library on their own to use it for telehealth because they don't want everyone hearing all about their health visit. So then we realized that we really need to market that this is not them walking into a desk, a table in the library and setting up a computer and talking to their doctor, but really to emphasize that there will be private spaces, and private rooms for people to use. So that leads us to the library spaces for telehealth, as Reed mentioned. If they can afford it and it's available, our libraries are looking for rooms that have perhaps separate entrances, but then you need the signage, to make sure people understand where the telehealth access points are. We got a lot of input from our community members who work with houseless, people who are experiencing houseless, and they say that, really need to plan how the furniture is set up, because it's just normal. If you're living out on the streets, you may come together with some critters and things like that. And we want to be able to wipe down the spaces and be mindful of what we set up in those places. The other thing is the room configuration. Some of our community federally qualified health centers have taps, and they made the room very welcoming by, making it cozy, kind of like a tea room. Maybe if it's a big room, they might have a room divider to just make it a little smaller. So those are some considerations that we actually didn't think of when we first started. And then Breed mentioned this as well in terms of staff support in the libraries. In our projects, we are not relying on the librarians to provide this kind of support, but they will be staff digital navigators to do the training on digital literacy as well as telehealth training. They will also cross over with doing the community outreach and coordination with our community-based organizations. And then all the operational support that Reed mentions, really you got to think of the scheduling and coordinating with the providers and the patients. Also, as I mentioned, getting the input from your community on what is needed is really important. So in Molokai, a very small rural island for us, the community there said they would love to have a navigator in the library that's only part-time, but then part-time with the clinic that's right across the street. So a community health worker type. So we're sharing that position. And this has changed now. The story has changed now, but we used to tell the story that the library had much better connectivity than the clinic across the street. So the provider, the PCP, who traveled back and forth from the Big Island to Molokai, would love to see her patients in the in-between time when she wasn't on island via telehealth. But from her clinic, the connectivity wasn't very good. The library had much better connectivity. Well, we started telling this story a lot, and the telecom carrier fixed her that broadband connectivity in her clinic. But in any case, seeing that real synergy working together to make this space work for the patients and the providers or something we're finding is really needed. We also thought it's wonderful, let's have the library staff get all the training that we're providing to the navigators, but we needed to be mindful of the responsibilities they have as well. And so it's not a requirement, but they're invited and it's always optional. So that was something we also learned. Next slide. So this is just my final slide to talk about how, we're really working towards digital health equity. In Hawaii, we say digital health equity for all, ALL, meaning it encompasses the broadband access and connectivity, access to the devices and equipment. The literacy part is knowing how to use it. And then the livelihood is for healthcare, but also workforce development, education, and even entertainment. So what we're trying to do collectively is to move towards digital equity for all. And do we expect overwhelming turnout for telehealth in our libraries and people waiting in line to use it? No, we really don't. We don't. But we do expect that we can work together to make the resources available, give people opportunities to get help, and give them the connection and the support. So really, really trying to help push digital equity. What can we do to do that? And this is something we can do. We do expect it's going to raise awareness for telehealth. There's been a lot of momentum built on telehealth and adoption. We want to continue that. And one thing I wanted to say here, I don't know if this is the case in other states, but in Hawaii, as we start to use the libraries for telehealth and our mobile clinics, we really see this as an infrastructure for future emergencies and disasters. We were not prepared during the pandemic. People identified libraries, the big space, the connectivity, but we didn't have it integrated in our state and county emergency plans. And further, with our Lahaina devastating fires there, we didn't have the mobile clinics integrated into the plan. So we really hope that all of this work is laying the foundation for future better emergency planning and support. And so with that, I just wanted to share that our TRC here in the Pacific Basin is working with our Hawaii State Libraries and the Department of Health to continue to really move towards digital equity through telehealth and libraries. Thank you. And with that, I'm going to turn it over to my colleague, Jaylene Johnson from NRTRC. Thank you.
Thank you so much, Christina. I always feel like the PBTRC has really set the stage for some really great programming, and hopefully you all found some inspiration from that today. But as Christina was saying, I'm Jaylene Johnson. I'm the program manager for the Northwest Regional Telehealth Resource Center. We cover the 7-state region of Alaska, Idaho, Montana, Oregon, Utah, Washington, and Wyoming. And I'm going to be closing out today by talking about the different resources, tools, and funding opportunities that are coming down the pipeline for projects like these that you may have and that relate to telehealth access and digital skills building. It's really a unique time in our nation's history to be discussing programs like these, as there's a lot going on in this space. I think a lot of you might be involved in some of these projects, but hopefully we have some information that maybe you haven't heard of that will be helpful for you in future planning for these projects. Next slide, please. So on November 15th of 2021, President Biden signed the Infrastructure Investment and Jobs Act into law. This act included a significant investment of $65 billion, that is billion with a B and not million with an M, $65 billion to help close the digital divide and ensure that all Americans have access to reliable, high-speed, and affordable broadband, as well as devices and services for building those foundational digital skills. The National Telecommunications and Information Administration, otherwise known as NTIA, has been administering the funds to implement the Broadband Equity Access and Deployment Program. Some of you may have heard of this as the BEAD program, and also the Digital Equity Act program, along with many other programs that are really trying to bridge that gap between access, literacy, and equity. Next slide, please. As you can imagine, there will be a lot of funding coming down the pipeline with these programs being deployed. Planning for BEAD and digital equity plans is now taking place in all U.S. states and territories, and the plans are actually being released for public comment through the fall. We really think that it's a benefit for all of you to review these plans and get involved in any way that you can now rather than later. And again, like I said, some of you may already be involved in this planning. We've read through many of the plans, and I think that they've done, most states have done a really, really great job at including the libraries in some of these. But we would also ask to consider, creating more community resources, like having that digital navigator that's also trained in digital health navigation, and also building community hubs like a telehealth access point in order for their communities to better access healthcare. Some states are past this public comment period, but currently we do know that, the last time I checked, Arizona, Washington, Kansas, Kentucky, Nevada, Puerto Rico, South Dakota, and Wisconsin currently have a BEAD and or digital equity plan that is open for comment. So there's just some steps that you can be taking now to get involved if you aren't already. And it will also just keep you informed of what's happening in your state by submitting your own comments. The QR code on the slide in particular contains a call to action and resources for comment to your state's BEAD and digital equity plans. We've been calling on a lot of our telehealth stakeholders within our communities to review these plans and suggest more initiatives for healthcare and telehealth, like digital health navigation and TAPS. And that is because we really see broadband expansion as an essential aspect of accessing equitable care for all. In a document, you will find a comment template for comment to BEAD plans to encourage more of that healthcare access. There is also a public notice of state BEAD and digital equity plans. This is where you can read through those plans and then also comment on them. There's a list of funding recipients by state. Also in the image on the slide is the one for Washington that lists out the BEAD program administrators and the NTIA contacts. There's also some helpful webinars and timeline information for these plans that you'll find useful. The webinar in particular that I've listed in this call to action was actually geared towards libraries. So I think you guys might really enjoy that one. We just put this out there to encourage you all to get more involvement too from your healthcare community in these plans and ensure that every person, regardless of their background or location, has the chance to access the care they need in the digital age by really raising that awareness on the need for affordable broadband access, digital health tools, and telehealth resources. Next slide. There's also some upcoming events and funding in 2024. The events that are listed on the left-hand side of the page are one, Net Inclusion, and that's coming up in February of 2024. If you haven't attended this in the past, I know that a lot of personnel from libraries do attend this. This is the national conference for the National Digital Inclusion Alliance. The conference contains a lot of really, really helpful information, ideas, best practices about digital equity and inclusion plans, and also community resources, building community ecosystems, all different things like that is geared around this conference. We highly recommend it. I will just see that there's also the Nonprofit Technology Conference that takes place in Portland, Oregon. This conference in particular, so this organization is called the Nonprofit Technology Enterprise Network, or NTEN. They actually put together a full certification for digital equity professionals. And they run a cohort of fellows, a fellowship which we participated in the last year, for digital inclusion. This year, for the first time at their conference, I know that they'll be having a full digital equity track. So if that is something that you're interested in, you'll be in the Portland area during that time. We highly recommend that as too. And then just to kind of toot our own horn, we are having a conference in Seattle, a telehealth conference in the spring as well. And the reason I want to mention our own conference is because we will have a whole day with a solo track for digital equity initiatives and also technology. We'll be having our technology showcase from TTAC on that day. We'll also be having a keynote from Angela Seifer, who is the executive director of the National Digital Inclusion Alliance. So we're really excited to do that. And again, it's going to be the only track we're going to have for that day. So everybody will be attending just that one track. There will be funding opportunities, as I mentioned before, lots of money coming down the pipeline for these projects in 2024. Some of the notices are that you might want to look at. And again, this is available within that call to action toolkit. But there is the Digital Equity Capacity Building Grant that comes through the BEAD funding, the Digital Equity Competitive Grant that comes through the digital equity planning. There's going to be many opportunities from the Infrastructure Investment and Jobs Act, and I've linked that on this slide. And then also state broadband and BEAD recipient information that you could see, because there's going to be sub-awards if you aren't already involved. So get involved now is all we're saying. And again, more to come. I think in the coming months, each individual state's going to have a lot of listening sessions, perhaps their own conferences. We've spoken at a few of these in our region that pertain to broadband expansion. So definitely keep a lookout in your own communities for things like that. One thing I'm just going to stress really quickly, and I think Christina already alluded to this, is I think the most important thing for these projects, and you can move to the next slide, is going to be building your community partner ecosystem. We cannot stress enough the importance of involving, the different community partners that you have in these projects. What we've seen a lot with telehealth access points is that they go up and nobody utilizes them, which is super unfortunate because they're such a great resource, especially in our region where we're relatively very rural. We're a very large space, but we're very sparsely populated. They don't get utilized because the community doesn't know about them. So again, we really stress building that community partner ecosystem for yourself. The success of our own projects would have not happened if it weren't for different organizations like the NDIA, the state broadband offices that we've worked with, and the BEAD funding recipients that we've worked with. And then also the community anchor institutions and organizations that we've talked to and kind of help plan for their own projects. Places like libraries, senior centers, community health clinics, community internet hubs, local healthcare entities, and other TRCs. We think that, by involving these, it also pulls in more healthcare into the conversation, right? So it also creates us as a community partner for you guys. I think before this, most of the people that we spoke with didn't really know about the TRCs or who we are or what we did. And now we can help them and help them build these projects on your own. And again, I'm just going to also stress by moving to the next slide that you should contact your TRC, coming full circle. Again, we can really, really help you with these projects. We're all really vested and interested in these projects. And if you are developing a telehealth access point, we definitely want it on our map. We think the map will really help to elevate some of these spaces and create awareness of them in the communities that you guys are serving. And with that being said, we can move to the last slide and we can close out for today. Please let us know if you have any questions or any comments.
Thank you so much to all of you. I really appreciate the excellent content that you covered. I think I haven't seen much in the way of questions during chat, but I'll give it just another minute or so. I think what really, you all drove home for me is it's a really complicated policy environment layered on top of a really complicated healthcare environment, and community anchor institutions like libraries do not need to be experts about those intersecting dynamics. You, as telehealth resource centers, kind of help hold that comprehensive view. And so if a library is interested in pursuing telehealth work, they can kind of reach out to their local telehealth resource center to get grounded in what's happening more locally. So thank you so much for bringing that perspective. I still don't see any questions, and I know that we are coming close to time. So what I am going to do is ask my colleague George to please pop the evaluation link into chat. If you are all able to take that evaluation, that really helps us improve our work, our offerings, and once you take the evaluation, it will prompt you on steps to obtain your MLA continuing education credit. And just one final note is that we do have 2 more sessions in this webinar series. We have a session on December 5th focused on telehealth double-edged sword, tapping into some of the equity and inequity issues that can happen with the digital divide and really highlighting the importance of digital inclusion, the great work that we talked about today in terms of digital inclusion. And then on Wednesday, April 3rd, we have a session on implementation of telehealth services in rural public libraries. So George will also pop a link in chat to how to register for those sessions. You can also find them at nnlm.gov/training. And with that, we will close out this session. Again, thank you to our fantastic panelists for sharing your expertise today. We really appreciate you being here and appreciate your work.
Thanks for watching. This video was produced by the network of the National Library of Medicine. Select the circular channel icon to subscribe to our channel, or select a video thumbnail to watch another video from the channel.